The MAP 3 trial, exemestane and breast cancer reduction. Welcome to the Everything Surgery podcast, where we delve into groundbreaking research and developments in medicine. Today, we are exploring the Mammary Prevention 3 trial, also known as the exemestane and breast cancer reduction study. The core objective of the Mammary Prevention 3 trial was to determine whether the aromatase inhibitor exemestane could lower the risk of invasive breast cancer among postmenopausal women who were considered to be at moderately increased risk for developing the disease. This risk was defined by certain criteria, which included being over 60 years of age, having a Gale 5-year risk assessment score greater than 1.66%, or having a history of atypical ductal or lobular hyperplasia or lobular carcinoma in situ. The trial, officially called the Mammary Prevention 3 trial and sometimes referred to as the XL or the NSIC Clinical Trials Group MAP 3 trial, was sponsored by the National Cancer Institute of Canada in collaboration with various centers in the United States. Participant recruitment took place between 2004 and 2010, with the primary results published in 2011. In total, 4,560 postmenopausal women at increased risk participated in the study. This was a randomized, double-blind, placebo-controlled study. Participants were assigned to take either exemestane at a dose of 25 mg per day or a placebo for 5 years. Notably, this trial was the first major prevention study to evaluate the effectiveness of an aromatase inhibitor, rather than a selective estrogen receptor modulator such as tamoxifen or raloxifene. After a median follow-up period of 35 months, the results were compelling. Exemestane was shown to reduce the relative risk of invasive breast cancer by 65% when compared to placebo. The reduction in risk was even greater for estrogen receptor-positive tumors, with a 73% relative risk reduction. Additional findings included a 58% relative risk reduction in the development of ductal carcinoma in situ, a 53% reduction in combined risk for invasive and ductal carcinoma in situ, and fewer cases of new atypical hyperplasias. Although the trial experienced a higher than expected dropout rate of approximately 30%, the analysis adhered to the intention to treat principle, ensuring that the results reflected the true impact of exemestane. Safety and tolerability were major considerations in this study. Importantly, there were no significant differences between exemestane and placebo in terms of cardiovascular events, fractures, other cancers, or death from any cause. However, those taking exemestane did report more menopausal symptoms, including hot flashes, fatigue, insomnia, joint pain, and increased sweating. It is worth highlighting that exemestane did not lead to an increase in venous thromboembolism or endometrial cancer, which are notable side effects associated with tamoxifen. The Mammary Prevention 3 trial provided proof of concept that aromatase inhibitors are highly effective for breast cancer chemoprevention in postmenopausal women. Exemestane emerged as a potent alternative to selective estrogen receptor modulators, offering superior efficacy and a distinct risk-benefit profile. While it did come with more menopausal symptoms and musculoskeletal complaints, it did not increase life-threatening side effects. Following these landmark findings, exemestane received approval from the United States Food and Drug Administration in 2014 for breast cancer risk reduction in postmenopausal women at high risk, including those with lobular carcinoma in situ, atypical ductal or lobular hyperplasia, or a Gale score greater than or equal to 1.66%. This expanded the prevention options available to clinicians and high-risk women, providing a third major drug class for risk reduction and enabling personalized choices based on individual risk factors, side effect tolerance, and menopausal status. In summary, the Mammary Prevention 3 trial demonstrated that exemestane is a highly effective chemopreventive agent, reducing the risk of estrogen receptor-positive breast cancer by approximately 2/3 in postmenopausal women at high risk. It provides a powerful alternative with a different and, in some respects, safer side effect profile than previous medications. Thank you for joining us on the Everything Surgery podcast, where we dissect the extraordinary in medicine and science. If you found this episode informative, please like, share, and subscribe for more content.